As compared to the previous outbreak, I think we're doing well. We're very prepared. We have sufficient personal protective equipment. We know a lot more about the virus and the disease and how to take care of patients. So I think we're doing better overall as compared to the previous outbreak. In the beginning of the pandemic, the first wave, there were a lot of unknowns, which I think we're doing better with now. We know how to treat the infection better. We also have better supplies of personal protection equipment. We know how to manage the flow of patients through our hospital. So I think overall we are doing better than the first wave of the pandemic. The demographics are similar. We are seeing some outbreaks within institutions, nursing homes, and other institutions, but we saw those during the first wave as well. So the demographics are similar. COVID is a viral infection. COVID is similar to other viruses with some differences. So it's similar to the flu in that you have body aches and cough and shortness of breath. There are some symptoms that are a little different with COVID. One thing is the smell and taste disturbance that some sizable fraction of patients will have. Patients may get more short of breath more quickly than some of these other viral infections. When a person develops symptoms of an illness that could be COVID, during this time of the year when we're seeing a lot of COVID in the community, the first thing obviously is to call your doctor. The doctor may see you in their office, or they may just talk to you over the phone or have a virtual visit with you. It'd be very important to keep track of some of the symptoms, particularly shortness of breath. If you're feeling very short of breath, you should come to the emergency room. Or if you're feeling like you're going to faint or something like that. But otherwise, be in contact with your doctor. It's very important to wear a mask when you're in public or particularly indoor environments. It's important to avoid crowds of people in indoor environments when you can. It's important, as it was with the flu epidemics, to wash your hands carefully and, in fact, to get vaccinated for the flu, because you don't want to have any respiratory illness during this outbreak. We just want to emphasize that we are learning more about how to take care of patients with this epidemic. It's going to be here for a while. We're anxiously awaiting the distribution of the vaccine, but that process will take several months, unfortunately. There'll be periods where it's more active and there'll be periods where it's less active.